Milo Sewards, and I'm the chair of orthopedic surgery at Temple University Hospital. I've been affiliated with the AOA for about 11 years now, and I'm the current program chair for the CORD conference. It is my distinct honor and pleasure to have championed Joseph Thoder as a pillar of orthopedic surgery for the AOA. Dr. Thoder has been a lifelong member of the Temple University community, having graduated from Temple University School of Medicine and then remaining at Temple for his orthopedic surgery residency before going to the Philadelphia Hand Center to do his hand surgery fellowship. After a brief stint in private practice, he returned to Temple, where he's remained and has been the consummate educator. In 2000, he was named the John Lockman Chair of Orthopedics at Temple, and that happens to be when I joined Temple. And it occurs to me that the reason I joined Temple was because I sat down with Dr. Thoder in my interview and realized this is a person that I need to work for. It has remained true over the course of the last 26 years. And although titles have changed, and I now find myself in the position that he was in, I still would never consider that he works for me, and I still think I work for him. I think if you speak to any of his residents, Temple has 4 residents a year, so hasn't had a ton of people going out into the orthopedic community, but the ones who have gone out into the community have absolutely been profoundly influenced by Dr. Thoder. He has not just taught orthopedic surgery, but he has taught us how to be orthopedic surgeons. And over the course of 26 years, as much teaching as he's done to the orthopedic residents at Temple, I don't know that I've ever seen him belittle a resident ever. In teaching us how to be orthopedic surgeons, he has taught us how to think, he has taught us how to act, he has taught us how to be able to relate to our patients. And for all those reasons, although he has never really sought national or international notoriety, he hasn't gone to other institutions and cast his net wide, but he has had such profound impact on those who he has trained, and not just around Temple. A lot of Philadelphia residents or residents in Philadelphia programs, whether it's from Jefferson, whether it's from University of Pennsylvania, whether it's from Einstein, they've had the occasion to interact with him, whether it's at Shriners Hospital of Philadelphia or at some of the other outlying hospitals. They've all uniformly commented on how effective a teacher he is. So in light of that, I felt that I had to champion Dr. Thoder as a pillar of the AOA. He espouses and upholds all the principles of the AOA, and I feel strongly that the membership of the AOA should be aware of his contributions to the practice of orthopedic surgery, specifically for those of us from Philadelphia. In so doing, I'd like to thank everyone who has been part of the contributions towards ensuring that he would be named a pillar of the AOA, and certainly have tried to do what I could do in that effort as well. On a personal level for me, Dr. Thoder has been a champion of me far more than I've been a champion of him becoming a pillar. There were times where in terms of my development as a resident, where he would talk to me about what it means to be a leader within orthopedics, and really stoked my own interest in leadership within the realm of orthopedic surgery. But even after I joined the faculty at Temple, without making a big show of what we would consider to be faculty development, he developed me along. And there were times where he would say, "I'm going to give you the keys to this car," and I'd say, I don't want the keys to the car. I don't want to drive the car. I don't have anything to do with the car." But whether he did it with intention or not, it wound up happening anyway. And so I have my current position and really everything I've done within orthopedic surgery, I have him to thank for it. In terms of a personal story that I know will make him smile, is my interview at Temple. I've known Dr. Thoder for much longer than just my 26 years since starting residency. I've known him since I was a young kid, because my father had trained at Temple and was a few years ahead of him. And as a young child, I had a football that was given to me by my grandfather, and I loved that thing. I played with it all the time. And one day I lost it, and I was distraught. I had no idea where it was, and as time passed, I guess I had forgotten about it, but still, it bothered me that I never knew where I lost it, how I lost it, or anything. And as I sat for my interview at Temple, uh, I walked into the room and sat down in the room that he was supposed to be in, and he wasn't there. And we kind of started the interview as myself and one of the other residents. And all of a sudden, he came bursting through the door like Kramer and Seinfeld with a football that had my name on it. And it turns out that the football had been taken for an annual resident football game, and it remained there until 20 some years later when it showed up again, and I showed up and he gave it back to me. So I still have that football. I still smile and think about that story. But the idea that he knew it was around and knew that I would enjoy getting it back speaks towards how he treated all of us as individuals, as mentees, as people who were more to him than just trainees, just residents that were going to go on and be orthopedic surgeons, that we were going to go on and represent him and represent Temple. And as I said, he's been around Temple for so long, it's in his blood. And it really, he has such a vested interest in us representing the place and the teachings that he has passed along from people like John Lockman. To me, that exemplifies why I feel that he should be a pillar of the AOA.
Hi, I'm Joe Thoder. I'm from Temple University in Philadelphia, and I've been a member of the AOA since 2003. The organization does phenomenal things. It's my favorite organization to belong to. And over the years, being able to participate in discussions over issues that really matter, that take over the tough stuff, not does a carpal tunnel better be done open or endoscopically. But when I found out that I was being honored with one of these pillar awards, it was incomprehensible to me that I could be counted among the list of people whose banners hang during the meeting and who are listed in the programs, et cetera, being true pillars. And if I can harken back to when Kevin Black gave his presentation, he referred to the term imposter syndrome, and I would echo that I sort of feel like that now. But nonetheless, I guess it is what it is, and I'm very honored to be recognized in this way. I'd like to thank my champion, Milo Sewards, for making this happen. The history between Milo Sewards and myself goes back to when he was 7 or 8 years old. His dad was a resident 2 years ahead of me, and we did a lot of things together, and Milo would tag along. Then I sort of lost track of him, and in the year 2000, I was named chairman of the Department of Orthopedics at Temple, and 2 weeks later, we had resident interviews. And sitting across the table from me was one J. Milo Sewards, who was a medical student from Jefferson just down the street. And fortunately, he chose to match with us. He completed his residency with us and did his Navy obligation. And then he did me the ultimate favor and came back and joined the faculty. He was program director, and I'm also happy to say that he is now chairman of the department. So it just kind of, the legacy went on, and I couldn't be prouder of him. I couldn't be more thankful of him for promoting me for this honor. Again, one last thing on the AOA, it is my favorite place to go for exchange of ideas on educational matters, on professional matters in terms of department finances, insurance issues, and delicate issues that aren't talked about out loud at any other meeting. So with that being said, I just want to thank everyone in the organization. The other obvious thanks need to go to my family. My wife and I have 5 children, and over the course of our lives working at Temple with 20 residents, we always say that we have 25 children. And we did wellness before it was popular, and I think that's part of the well-rounding education that we should offer to these young men and women who are becoming orthopedic surgeons. So shout out to my family, shout out to everybody in the AOA, Shout out to the past, present, and future Temple orthopedic residents to keep the faith and carry on the traditions that have been set forth for you. Just modernize them for the current days. I would also like to thank those members of the AOA who contributed to the funding of this honor, and I hope my name does it proud. And thank you for your contribution so that we can make all this happen.